what we know about the BA.4 and BA.5 variants is that they have an immune escape whether you've been vaccinated previously or had COVID previously. So the FDA asked Moderna and Pfizer to kind of re-engineer the vaccine so it still covered the original COVID variants, but had a sort of a second element that contained better activity against BA.4 and BA.5. So Moderna and Pfizer have both produced what's called a bivalent vaccine. This concept of having a vaccine that gives activity against different strains is what we see in influenza. With influenza, we need a new vaccine every year. It targets new strains every year, and each influenza vaccine targets 3 or 4 strains. So it's not a new concept. And, BA.5 in vaccinated people has produced, moderately bad illness in a lot of people. Enough to miss work, not enough to be in the hospital. So you can avoid that. You can avoid transmitting it to people who may be more vulnerable and avoid long COVID. Again, if you're vaccinated, the risk of long COVID is lower, but not zero. So another benefit is avoiding long COVID. It is restricted in the case of Moderna to people over 18 and Pfizer over the age of 12. But everybody who's been vaccinated with the original vaccine, whether they're boosted or not, should get this additional protection unless they've had a prior boost in the last 2 months, even if they've had COVID. The prior vaccine have been very effective in keeping vaccinated people out of the hospital and out of the ICUs. We're still seeing a lot of community transmission. There are still people who are unvaccinated who are coming into the hospital. So the idea is these new boosters will give better and longer lasting protection against these new variants. And the concern again is that as the weather gets colder, people more congregate indoors, we may see increased transmission of BA.4 and BA.5. Therefore, there's some urgency to get people better immunity against BA.4 and BA.5.